Podcasting from the base of Lake Tahoe in the eastern Sierras comes the Medicine Wheel. We are a group of progressive physicians seeking solutions and enlightenment while surfing the seas of big data and summiting mountains of research in an effort to make the practice of medicine more personal and medical knowledge more accessible, and empower you, the listener and viewer, to be as healthy as possible. Now, the Medicine Wheel.
Hello, I'm Dr. Michael Gerber for Medicine Wheel. Today, we're plodding, I hope not too plotty, through the alphabet of medical interest and integrative medical interest. And we're moving on into the B's. So we have to start, of course, with B number 1, thiamine. Thiamine was discovered in the 1930s when there was an epidemic of heart failure and enlarged hearts, especially in Japan, when they started following the fashion of taking their native rice and polishing it and to take off the outside coating of the rice, which contained thiamine. And it caused beriberi, which is enlargement of the heart. It was wet and dry, beriberi, but it was enlargement of the heart and caused heart failure. And this is when it was first acknowledged to be a very important part of our human diet. So thiamine is also very important on a number of levels. It is incredibly important for alcohol detox, and ethanol actually is an antioxidant, but it breaks down into acetaldehyde, which is like formaldehyde, embalming fluid, and that's what causes all the damage of alcohol, brain damage, liver damage. So ethanol is broken down into acetaldehyde, which is in turn broken down by acetaldehyde dehydrogenase, which is an enzyme that is totally B1 dependent. And if you run out of thiamine, B1, that enzyme stops working and the acetaldehyde lingers over a longer period of time and causes alcohol to do its damage. So we always suggest for people who consume alcohol to take 500 milligrams of B1 before bed after alcohol consumption, and this reduces the toxicity of alcohol on the body. So remember, take your thiamine before bed. B2 is riboflavin, and that is very important for our energy metabolism, makes NAD, nicotine adenine dinucleotide. It requires riboflavin B2, and it's very important for the mitochondria, our little energy manufacturing plants in the cells, to have riboflavin. And so it makes our energy and our ATP production, so riboflavin is very important. It also is of interest that it is the B vitamin that is yellow in color. So it turns the urine bright yellow when you consume riboflavin, B2. B number 3 is niacin, or nicotinic acid, and it's co-B3, Niacin Amide. Niacin is famous for the flush, and it turns people bright red and itchy and can be very uncomfortable, whereas niacinamide doesn't do that at all. It was first noted in the 1930s in the southern part of the United States when the diet was very high in corn and low in protein, and the disease pellagra was first noticed. And pellagra, people turn red and their tongues swell up and they have psychiatric difficulties. Noting this, a very famous orthomolecular pioneer, Abram Hoffer, MD, and his cohort, Sir Humphrey Osmond, both Canadians, started thinking about using niacin in schizophrenia. So in the 1950s and 60s, they first started doing experiments giving niacin to schizophrenics in very high doses, and it was by and large highly successful. It kept schizophrenics back at work and more able to be in society. So niacin, when taken in high doses, goes above the flushing threshold, and people no longer flush. Niacin Amide has been noted since the 1940s to be a treatment for osteoarthritis, wear and tear arthritis of the joints, in high doses, about 1,000 milligrams 3 times per day. And when worked up slowly, it's very easily tolerated. Too much niacinamide can cause nausea, so people have to work up to it gradually. In cardiology, it was noted in the 1970s and 80s to be a cholesterol reducer, and it still is used as a cholesterol-reducing substance. Now, of course, cholesterol and the whole idea of cholesterol being the total bad guy in cardiovascular disease on many fronts has been debunked as cholesterol is actually an antioxidant, and it's good for us, except when it's in very high concentrations. So niacin treatment is great for mood disorders and depression. And again, people have a sore red tongue, swollen red tongue. That is a niacin deficiency or B3 deficiency. B5 is pantothenic acid, or pantothene, a double pantothenic acid. And it's very important to support the adrenal glands. And the adrenal glands are the little pyramidal-shaped organs on top of the kidneys that give us all of our energy and anti-inflammatory effects. So it's been very, very good for allergy support over the years. B5 has also been used as an acne treatment and is sold commercially on television as an acne treatment. So B5 is another wonderful B vitamin. B6, pyridoxine or pyridoxyl phosphate, which is the active form, is an important cofactor for neurotransmitter manufacturing, which are all of our brain chemicals, and keeps us awake and alert, in good mood. It's also a mild diuretic and has an anti-nausea property, especially when used in pregnancy, for the nausea of pregnancy. It's also very helpful in Parkinson's disease, and it also blocks prolactin, which is interesting. Prolactin is the pituitary hormone that, when in nursing mothers, causes the milk to be secreted from the breasts. And sometimes mothers keep using their prenatal vitamins, which is high in B6, and good to prevent nausea, but it also can block prolactin. So it's a good idea for nursing moms to stop their prenatal and move on to another multivitamin. Deficiencies also can cause chylosis, and chylosis is cracks around the corners of the mouth, and that's a deficiency of B6. Moving along to B9, which is folic acid, and methylfolate, which is the active form. And it prevents spinal cord disorders, neural tube defects in the developing fetus and spina bifida in infants during pregnancy, and is very important. It also is important for patients that have genetic defects of MTHFR, methylene tetrahydrofolate reductase, which is a genetic block that inhibits people to do methylation. And methylation means when you add a methyl group, which is a single carbon, to other molecules to help the body detox. And people that don't have MTHFRs also exhibit a high homocysteine, which is a backshoot of methionine, which usually signals an MTHFR defect. And this causes difficulty in detoxification and increased blood coagulability, or sticky blood, and increased risk of heart attacks and strokes. So having folic acid in your supplementation is probably a very good idea. Now B12, it goes right along with folic, and it's the anti-pernicious anemia vitamin. So people that have the MTHFR blockage need it also, but it's a good idea to be supplemented in vegetarians because it is an animal-based vitamin, so it needs to be supplemented in vegetarians. And people who have deficiency of it also causes large red blood cells. So people that have a big red blood cells need to take extra B12. And this can be supplemented sublingually, and of course it can be given by shot, which we have done for 45 years, and it's very helpful for people's energy production as well. Deficiency of B12 can also cause memory deficiencies and early brain aging. So having adequate amounts of B12, either by supplementation or in your diet, is important. Well, betaine is our next B, and that's trimethylglycine. And it helps with high homocysteine and the MTHFR mutation that we just mentioned. And it's also helpful when in the hydrochloride form. It improves stomach acid. And stomach acid is very important. We need our good stomach acid to digest our proteins and absorb minerals. And Jonathan Wright, MD, our old friend and teacher, colleague from state of Washington, has given us a new pause. So we all know about menopause, when women's hormones start going lower at menopause, and andropause, which is when men's testosterone starts reducing as we age. But he also introduced the concept of gastropause. So as we age, our stomach acid also goes down, and our ability to absorb our nutrients in our food is also weakened. So stimulating hydrochloric acid production with betaine hydrochloride is a very good idea as we age. Now we have a product called Biogest, and that has betaine hydrochloride, glutamic acid, and digestive enzymes. Papain, which is from the papaya plant, bromelains, which is from the other plants, and pancreatic enzymes to improve absorption and digestion. It reduces gas and bloating, and again is a treatment for gastropause. Now bromelains, again, these are enzymes from the pineapple root, which are anti-inflammatory, digestive, and helpful for bruising, arthritis, and allergy. There's the old football player's trick of getting bruised up on game day on Friday night or Saturday and taking lots of pancreatic enzymes or bromelain, and the bruising is diminished by their next practice on Monday. So people that have bruising or swelling of any variety can be helped by bromelains. Berberine. Berberine is coptis herb from China. It's also called golden thread, from which Rapunzel got her name. It's high in golden seal, Oregon grapefruit, and it's great for a number of digestive disorders, including Helicobacter pylori, which is present in about 50% of us. And Helicobacter is a bad boy bacteria that causes stomach ulcers and duodenal ulcers and a great number of other autoimmune problems. It is also helpful to reduce blood sugar in diabetics. And berberine is an aromatase inhibitor. Now, aromatase is the enzyme that inhibits the conversion of testosterone to estrogen and testosterone to dihydrotestosterone, which is a stronger testosterone, and that can increase enlargement of the prostate and hair loss. So berberine has been used for centuries in Chinese medicine and in Native American herbology. Berber, B-U-R-B-U-R. It's a grass from the Andes Mountains, and which is a drainage remedy. It helps open up lymphatic systems, liver, and kidneys, and is very valuable when patients are going through detox, especially when killing Lyme or other infections. So it helps the body if people are having a detox reaction, mild fevers, little depression, weakness, fatigue. This helps to alleviate those symptoms. And so Berber, which is, again, a grass from the Andes, is a very helpful remedy to take during detox or when people are killing parasites or bacteria. Boluque, lumbrokinase. And Boluque is a brand of earthworm enzymes which thin the blood by blocking fibrin formation. When doing live cell analysis, we can see blood from a drop of blood under the microscope, and fibrin is precipitated and it looks like hay straws, and this is part of the clot, and Boluque inhibits that. So it can be done 2 to 6 per day of these capsules, and it is very important to keep our blood thin. It also helps to reduce the coating on bacteria and parasites and fungi, which inhibit the body's immune system from attacking it. Bergamot. Bergamot is an extract from oranges from southern Italy, and it is very important to lower cholesterol and triglycerides, which are blood fats. So it's non-toxic. It's an orange extract, and it has other antioxidant functions as well. Butterbur. This is a herb which has been proven to treat and prevent migraine headaches. It's usually given in combination with feverfew herb for migraines. It can be done routinely or as needed for treatment for migraine headaches. And a lot of migraineurs love butterbur, and again, there are no side effects. Belladonna, which means pretty woman. Belladonna was first used in Italy and other Mediterranean countries, and women before going out on dates would take a little bit of this fairly poisonous herb in high doses, and it would make their cheeks red and dilate their pupils, hence belladonna, pretty woman. So they used it as that for many years. But highly diluted, it is powerful for many ailments which have sudden onset and severity, such as high fevers and teething. In regular allopathy, it's used in regular medicine, used in very small amounts for abdominal pain and irritable bowel syndrome. It's great for rage and sudden redness of the face, and so it's great in children and people who have issues with explosive psychiatric conditions and rage. Black cohosh and blue cohosh. These are herbs that have been known for centuries around the world and have mild estrogenic properties to help with menopause and fertility issues. Especially for people after stopping birth control, it helps to regulate their periods and return fertility. It's also a uterine tonic, and it's great to control bleeding after childbirth. And it's a hemostatic, and it shuts down the uterus after childbirth. Homeopathically, in its very diluted form, it's used for threatened miscarriages and many other syndromes around fertility. Blueperum. This is a Chinese herb that's used for treating excessive heat in the body, high blood pressure, anger, and it's frequently a male herb given to men. Bucco, which is a combination of herb tinctures from Nestmann Company in Germany. It treats kidney afflictions and prevents kidney stones and inflammation in the kidneys. Borax, which is boron, which is a trace mineral important to treat arthritis, open cell membranes, and it takes calcium out of soft tissues and places it into bone. It also protects us from electromagnetic fields and many more uses. It may help to detoxify our pineal gland, which is from the pine cone that sits in the middle of our brain, and it's the pineal gland makes our melatonin. And melatonin, of course, is the guy that helps to turn down all of our anterior pituitary hormones and helps us to sleep at night. It is also very powerful as an anti-cancer agent and anti-inflammatory agent. So boron helps to decalcify the pineal gland, which starts becoming calcified at puberty. So it takes calcium out of the wrong places and out of our joints and puts it into our bones where we need it. Bryonia, this is an important herb, but when used in homeopathic potencies, it's great for arthritis and pain and irritability and inflammation of all membranes. So Bryonia is the homeopathic for osteoarthritis that's worse with exercise and worse with movement. Beta-sitosterol is very useful for enlarged prostate and is found in Pygeum africanum and other herbs that are helpful for the enlarged prostate, especially in aging men. Borage oil. Borage oil is a good source of GLA, is an anti-inflammatory fatty acid which treats arthritis and skin diseases. It's another one of these oils and anti-inflammatory oils that's great to help alcohol toxicity. GLA is blocked by alcohol. And there are borage and primrose societies in Europe that have taken these oils and plants for centuries to promote longevity and good health. Well, here are a few of the B's, and I'm Dr. Michael Gerber for the Medicine Wheel. We'll see you soon for the C's. Thank you very much.
The Medicine Wheel encourages all of our listeners to subscribe to our newsletter and podcasts as we continue to explore the world of medicine, bringing you up-to-date health and science information. The Medicine Wheel invites our listeners to email us any newsworthy stories or topics they wish to explore further and discuss on the podcast. For more information about the Medicine Wheel, please visit us at our website, www.themedicinewheel.org, and on Facebook, and finally on Twitter and Instagram at The MedWheel.
In an effort to support access to integrative medicine and functional medicine options for those in need and education for those who need information, please consider donating to Project OmCare, 501c3.org. Please go to our website, www.themedicinewheel.org, to learn more.
Thank you again to all our local sponsors, Grateful Gardens, Lighthouse Coffee, and Dorinda's Chocolates, which represent some of the best organic and appetizing options in the Reno, Tahoe area.
Lighthouse Coffee Shop is a proud sponsor of the Medicine Wheel. We are a family-owned and operated local coffee shop. Our goal as a business and a family is to cultivate community wherever we are. All of our coffee is ethically sourced, organic, and farm fresh. It's roasted in-house daily, guaranteeing you access to the freshest cup of coffee on the planet. We care deeply for our community and everyone in it. We strive to provide you with the best ingredients and most comfortable environment. Come and enjoy coffee with us. We are family, and we would love for you to be part of it.
Gerber Medical Clinic is proud to support the Medicine Wheel and medical education to improve health quality, nurturing the lifestyles of our listening community, enhancing wellness for all. Thanks again to Wired Insights and their talented team for making our podcasting dream possible.
In closing, we would like to remind all of our listeners, if you have a medical concern or diagnosis, You need to see your personal doctor without delay, and if needed, obtain a referral to a specialist. If ever you feel the health issue you have is urgent or an emergency, please call 911 and go to your nearest emergency room. Please do not take any of our physicians' commentary or our guests' opinion as medical advice, and always seek out medical care from fully licensed and appropriately trained medical professionals in your area. The information shared in this podcast is for general information only and should not be construed as medical advice, and understand that no doctor-patient relationship is formed. The use of this information and educational materials linked to this podcast and website are employed at the user's own risk. The content of this podcast is not meant to be used as a substitute for medical advice, diagnosis, or treatment.
This is the Medicine Wheel signing off for this week with a reminder to live, love, listen, and learn.